listening to the Pharmacy Podcast Network.
Are you struggling with marketing your independent pharmacy? Pharmacy Marketing Simplified brings you innovative, easy-to-implement solutions from industry experts who have developed a knack for solving problems. A publication by GRX Marketing, who has a team of over 45 years of pharmacy marketing experience.
Hey everyone, thanks for joining me on the next episode of Pharmacy Marketing Simplified podcast. This is Nicole McClure, your host. Pharmacy Marketing Simplified is part of the Pharmacy Podcast Network. And today I am so excited to have Debbie Marcello, founder and CEO of Happier at Home, here with me today to talk about marketing beyond prescriptions with a home healthcare franchise. So Debbie, welcome to the show.
Hey, Nicole, thank you so much for having me on. It's a pleasure.
Yeah, we're excited to have you here. So for our listeners that may not be familiar with Happier at Home, can you talk a little bit about the program that you have?
Sure. Happier at Home was originally started just as a home care company. I started it in 2007, and it was my local corporate location. And as I found that Happier at Home had some unique propositions as a business model, I decided to set it up as a franchise so I could share that business model with other companies and with other people. So probably about 6 years ago, I started franchising Happier at Home. So now we're currently in 15 different states and really focusing on the independent pharmacy owners as our franchisees. So those folks are able to use our business model to be able to offer services like companion care, personal assistance services, advocacy, and medication management solutions.
Awesome. And is the draw to independent pharmacies, I mean, obviously they offer a lot of services for seniors, but just because a lot of them have that compassion for the senior population, or kind of what was your thought process with that?
So it was really sitting back and evaluating which of my franchisees was doing really well. So one of my first franchisees was an independent pharmacy owner in Western New York. And he owned and still owns 2 or 3 pharmacies, including retail location, doing long-term care, and providing medications in facilities. So I saw how well they were able to follow the model, but then also really ramp up quickly with their Happier at Home business. So when I saw that, I thought, you know what, I'm going to really focus on independent pharmacies, because as I learned more about the challenges that they had, I knew that this could really help them to expand their services and reach out into their community, helping improve the quality of care in their community as well.
Gotcha. Yeah, it's just a great partnership. So for those of you that may not know, November is Caregivers Month. So a great time to talk about this topic as well. How would you say that Happier at Home helps pharmacy owners expand their services to what they're already doing?
Well, in so many different ways. Some pharmacy owners offer DME. They have customers that are coming in, patients that are coming into their retail location. If they're offering services like to long-term care facilities, they've developed these relationships with so many different types of people. So you have relationships that they've built with customers, the patient's family members, with potential referral sources in the healthcare system. So we really help them to capture their relationships and their reputation that they've built in their community, and be able to offer those different people or different groups of people their services to help their community stay in their home and stay independent. So they've developed themselves as a trusted resource. So, I mean, I know so many of the pharmacy owners out there have had people come to them and say, you know what, my mom's not doing great, and I just don't know where to turn. Do you have any ideas? So in this way, they could actually help that person and provide care in the home instead of referring it out to someone else. So it really helps those patients that are coming in. It helps the family members that are that sandwich generation where they're trying to take care of their aging parent and they have a family or younger children at home they're trying to care for. So it's really tough to be in that position. Mm-hmm. And this really helps them to be able to give them an opportunity to help those people as well.
Yeah, for sure. And by tying it in with the pharmacy, I mean, in some ways, one of the struggles of launching a new business is taken away because they already have a base of people that they can reach out to about these services. So that's kind of nice. It's not starting from scratch. Right. And I would imagine it helps the pharmacy business as well, because now you've got caregivers or other members of the family that maybe aren't using the pharmacy, but want to use the home care services. So yeah, it's just a great tie-in.
Right. And as you're building that patient base in the home, one of the biggest trends lately has been expanding your pharmacy services with the long-term care model or medical home model. Mm-hmm. So you're going to be getting higher reimbursements. So here you're developing, as a Happier at Home franchise owner, you're developing a patient base in their homes. And so then that's a feeder for your pharmacy services as well. You could develop in-home immunization programs, provide their medications in their home. So that's the long-term care medical model at home, DME in the home. There's so many different synergies between being a feeder for the pharmacy from your Happier at Home patients, but then vice versa from the pharmacy into becoming patients as well.
Yeah, for sure. Any challenges that our listeners might need to think about when opening a franchise?
So the biggest concern I hear from every single person who calls us is hiring. And, I feel that in the pharmacy, they have a more difficult time hiring techs and the folks that are going to work for them in their pharmacy, as opposed to those people who are going to be your caregivers. So we have great relationships with our caregivers. That's one of the things that we make sure that we're training our franchisees on, is how to recruit, who is the best type of person that you're going to want to look for, and then maintaining those relationships. So we have a really low turnover rate in the industry, and it's because of our processes that we have. So one of the things that I always encourage people who are interested in becoming a franchisee to do is to validate that we really are helping and supporting in this recruitment effort and support and training with our current franchisees that are also pharmacy owners, so that it's not as intimidating as it seems. As long as they're following our process, it's not a problem. The hiring is not a problem. So, and the other thing I hear is that the pharmacy owners don't have time. But with our model, what we do is help that pharmacy owner to recruit and hire the right person. So if you don't have someone in your pharmacy that could step into that role, then being able to find the right person who's going to run and operate your Happier at Home company.
Yeah, that's awesome, because I think having those processes already in place makes it probably take a load off for the pharmacy owner, for sure.
For sure. Yep, definitely. And we're with them every step of the way. We really have great support. We have a dedicated franchise business coach, and he's just a wealth of knowledge and He really is an expert in training, and we have a established learning management system. So there's a lot that we offer. As a matter of fact, I always think about it. If I wanted to start a business again, I wouldn't start it from scratch like I did, 15 years ago. That's difficult.
It's hard. Yeah.
Yeah. But if someone came to me and said, here, these are all the systems, we have all your marketing materials, we'll support you, just get to it.
Yeah. Just
I would do that.
Yeah, for sure.
Yeah.
Any other common misconceptions that you hear from pharmacy owners that are interested in starting a franchise that, maybe think it has to be one way, but like, no, it's this?
So one thing I do hear is concern of their area being able to support private pay source of revenue. Mm-hmm. So Happier at Home is great majority derives our source of revenue through private pay. So no insurances, which is double thumbs up.
Yeah.
No influence on pricing, no dictation. So how we resolve that is that we will take a look at the territory in your area. So we look at the demographics, we give a large population of your protected territory, and we look at the average household income and the income of the seniors. So we really look at everything to make sure that it's a good, solid, robust territory that could support private pay.
Okay, that's awesome.
Yeah.
Have you been in a situation where you turned down a pharmacy owner because maybe they're not in a high enough income area, or do you just try to shift the territory, or kind of how does that work?
We have not turned anyone down. What we do is make sure that we expand the territory. So if their pharmacy is located in a low income area, we will make sure that those numbers aren't included in the number of population, but instead we'll expand the territory. And really, it's by zip code. So we'll just keep adding enough to make sure that that average household income is high enough for you.
Gotcha.
Yeah.
All right, let's talk about marketing, since it's a marketing podcast. Curious what you found is the best way to market these services. Kind of two-part question. So just on their own in the community, and then also cross-promoting with the pharmacy.
So I love marketing,
Yes.
and that's why I have my own podcast, and it is a lot of work, as we were talking about, discussing, but I really enjoy the marketing part. So the best way we found is not just one approach. It is the pillars that you rely on. So definitely forming those relationships with the healthcare providers in your area. So that would be more of an in-person thing. So leveraging those relationships that you have with the healthcare system that you already have through your pharmacy. But then also expanding and becoming involved in different community events. So that Happier at Home name is always out there. The other thing that we do is I go on our local Fox News channel every week and talk about any issues having to do with senior care and caregivers. And so we provide those video clips to our franchisees to be able to use with their own email campaigns and things like that. And then we will post those on our franchisees' websites, which we will handle all their content development and the websites for them.
Nice.
So it really improves their SEO when you have the videos, and there's always new information there too. Yeah.
Yeah, it's nice you guys offer that to do it for them. Because, with our services as well, we do the same thing, because otherwise we've just found that it won't get done. So
you're right.
Having that process in place is good.
Yeah, I just remember back when I started the business years and years ago, I knew it had to be done.
Yeah.
It's so important. And it was always a stress because I didn't have enough time to get to it. So it's definitely a value add for that. And, I think our marketing materials are really great. So that's something that we do for the franchisees also, is develop any of those assets that they could use for print and that type of thing too.
Yeah. No, you guys do have great stuff. I've seen your stuff before. Any success stories or stats you want to share with our listeners?
I would say the entire reason that I started focusing on those pharmacy owners is because of the success of the first franchisee that I had was as a pharmacy owner. He's doing incredibly well. He started out with one territory and now he has 3. So that's 2 in Western New York, and he owns and runs one remotely, which is in Texas. So he has definitely embraced our processes, and as he says, you know what, it's not that difficult. Just do what we say. Yeah. And it works. Our system works. So I'd say he's definitely our success story. And that's Trent Vocal of Buffalo Pharmacies.
Awesome.
Yeah.
Well, anything else you'd like to touch on before we wrap things up?
I would say that I think that the pharmacy owners out there know that you definitely need to diversify. If not through Happier at Home, you need to really use your experience, your position, and understand that you are and can make yourself the hub from which your patients can utilize different services, not only in your pharmacy, but you have an opportunity to expand and be very entrepreneurial and use your education, your smarts, your relationships, and leverage all those to be able to diversify and really be able to expand. Because right now in today's environment, if you're standing still, then you're really falling back. You're not standing still. It's like inflation. You need to make more. You got to keep going.
Exactly.
So that's what I would say is just find, strategize. Now, first of the year is coming. Don't wait till the first of the year to figure out what you want to do. You should be doing that right now. Get it down in writing and follow your path and start growing.
Yeah, well said, for sure.
Yeah.
Well, thank you for joining me. If people are interested in finding out more, how can they get a hold of you?
They could visit our website at happierAtHomeFranchise.com. And there's a lot of videos, a lot more information on there, but you could also just input your contact information and we could reach out and connect with you.
Sounds perfect. Well, thank you again for joining me. Happy to talk to you again.
All right, Nicole, it was great talking with you too, and great to see you.
Yes, likewise. Thank you for joining us today on the Pharmacy Marketing Simplified podcast. To find out more about pharmacy marketing, visit us experts at pharmacymarketing.com.